finished analyzing the data, the conclusion won't change. He also said they had a duty to report this now, since this will be considered a new standard of care as other trials are currently underway. And we're going to speak with an expert right now, Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins University for health security. He's also an emergency medicine doctor who specializes in infectious diseases. Doctor, thank you so much for joining us. I'm so glad to have you here because I want to talk to you about this news regarding Remdesivir, this trial showing significant shortening of recovery time. There's still so much we don't know. So I want your reaction to this, but also how skeptical should we be of this?
This is very good news. We've seen some data trickling out on Remdesivir, some of it better than others. This seems to be unequivocally good news, and we have to add this to the data that we already have on Remdesivir. And I do think it is an important, significant finding that you can get people recovered quicker with Remdesivir, and that can substantially decrease your burden on hospitals if people are getting out of the hospital quicker. And it will be something that we want to try to use on individuals who meet the criteria to use it. And I think that's another important thing, is trying to understand who we need to use this on, what's the time window, all of that. So I'm very optimistic. I'm not skeptical of these results. I think they are very good and good news for everybody all around.
And I wanted to ask you, Dr. Fauci said, they were releasing this information now, as he put it, even though not all the I's were dotted, T's crossed, because as these other trials are underway, he said this is a new standard of care. Can you explain that for us, what he means by that?
What it means is standard of care means something that you do for everybody, that's what you're expected to do. And what that will mean going forward is that if you're doing clinical trials, if people are at the state of what they were in this trial that the NIAID conducted, you have to really make sure they're getting Remdesivir, that it becomes kind of unethical to give a placebo if you know that the treatment is effective. There's obviously subsets of patients where it may not be effective, and there you can do placebo-controlled trials. But for people who match the type of people in this trial, you should be giving Remdesivir, according to what Dr. Fauci is saying. I haven't seen all the data yet, but it looks like that's what is going to be the new way going forward.
So I know you said this is positive news. Where do we go from here?
The next step really will be the FDA evaluating this trial data to see if this drug merits what's called an emergency use authorization. That's not a full approval, but because we're in a public health emergency, we are seeing products come to market faster. So that, I think, would be the next step. And then really would be translating this trial data into clinical practice guidelines, trying to figure out who are the patients that benefit from this, what is the time window you give to them, how long do you give it to them for. All of that will then be taken to almost like a hospital level protocol that will become hopefully the standard of care if this data is as robust as we're hearing.
Well, I'm so glad we had you here to discuss Remdesivir, but I do want to ask you some other things, developments as we continue to see the COVID-19 pandemic play out. President Trump said on Twitter that the U.S. has the most cases in the world because it's testing more. What's your assessment of that?
Well, we are testing more than other places because we're a bigger country, but testing per capita isn't necessarily the highest, and it's very spotty across the country. The fact is we had an explosive hotspot in New York City, a very highly population dense place that really drove our numbers. And that's really what happened, is that we had an infection spiral out of control in New York City because there wasn't case contact investigations, there wasn't diagnostic testing, we weren't testing mild cases, and allowed these cases to accumulate to the point where New York basically almost went into complete crisis over the number of cases. So I don't think that there's any kind of silver lining or good thing about our testing policy here. It's been the main reason that we're in this situation with economic shutdowns across the countries, because testing has been faltering basically since January.
And we've heard governor after governor saying testing is key to easing restrictions and reopening. How much testing should the U.S. be doing? I know the administration said earlier this week it would provide enough supplies for, I think, 2% of each state's population. Is that enough?
There's not a one-size-fits-all number. Some states have been relatively spared from infection, and they have a very low rate of cases, and they are having robust enough testing that they can actually rely on that, meaning the test numbers are flat or they're going up and the percent positive isn't a concerning level. But there are other states where the testing needs are greater. So I don't think that it's got to be a number that every state applies or every county applies. It really has to be driven by the data, and you're going to see differences across the country. And I don't like to just pick a number and say that's what we should do, because it really ignores the fact that this is a heterogeneous outbreak across the country, and one state's testing needs may be greater than another state's testing need.
We are seeing some states easing restrictions, allowing businesses to reopen. As a health security specialist, do you think they should be at this point? And is there a certain state's reopening plan that you would suggest as a model for others?
Well, again, this is a heterogeneous outbreak across the country, and there are some states that are in better positions to reopen. But what we want reopening to be is data-driven, that you actually are in a place where you have enough testing, you have a health department that's fortified enough to be able to do case contact investigations. And the most important thing is that your hospitals are ready to take cases, because when we relax social distancing, it's inevitable that cases will go up. The point here is to try and keep cases occurring at a low enough clip that hospitals can handle them. That's the whole benefit of it, is preserving hospital capacity. And you want to have data showing that your hospitals are okay, that you have robust testing, and that you have the ability for your health department to function appropriately with the number of cases that they're going to get. There isn't one state's model plan that I completely endorse. I think they're all different, and they're all based on different state needs. But I think all of those three elements that I mentioned earlier have to be present for a reopening plan to happen in a safe manner. And you also want to be able to titrate or adjust what's going on with your cases. So if you start to see your hospitals get back into crisis, you may have to modify your reopening plans. But the whole point is it has to be data-driven with an eye to your hospital capacity the entire time.
Dr. Ramesh Adalja, Senior Scholar at Johns Hopkins Center for Health Security, thanks so much for your insight. Really appreciate it.
Thanks for having me.
California Governor Gavin Newsom announced an initiative to provide food to those in need while also helping the state's farmers and ranchers. Food banks in California have seen a 73% spike in demand for their services, while farmers and ranchers are experiencing a 50% reduction